Okay, so for these lessons, we are going to look at this cardiac cycle. So a cardiac cycle, basically, we look at the events that actually take place for the blood to enter into the heart and then leave the heart. Okay, for both sides, right sides and also the left side of the heart. Okay, and the contraction is almost simultaneously. Yeah, it's not like one side pump and then continue another side. No, they pump at the same time. Okay, so what it means the cardiac cycle. So in the cardiac cycle, you can see that the heart will contract and relax in the rhythmic cycle. So it means that it's not like they are coordinated well. They are coordinated well. It's not like simply, means a contract and relax. So generally, it contract so that they can pump the blood out of the heart and relax so that the chamber can fill with the blood. And contractions and relaxation of the heart in this case basically change the pressure. Are you clear? In the chamber. So the pressure increase or decrease. So always remember, when we contract or when the hearts contract, basically they're going to increase the pressure. Right? It's same thing. You try to imagine that you have the balloons, okay, the balloon, okay, the long balloon, you press at the center here, the air will move to two sides, correct? Or you press at the end, it moves to another end, because why? Pressure increase. But when you relax, then you're going to decrease the pressure. Okay, so means that the blood won't know which direction to go. So means that they have to follow the contractions and relaxations of the heart, and guidance by who? Will be controlled by the valve that we have learned previously. So we have two kinds of valve that involve in this process. One is the AV valve, atrioventricular valve. We have two of them, tricuspid and bicuspid, and also semilunar valve in between the pulmonary artery, aorta, and also the heart. Okay, so we're going to look at those of them. So one complete sequence of pumping and filling is referred to a cardiac cycle. Generally, we have three phases. One is a systole. Systole can be divided into two. When the first time we have the atrium that contract. So we call it atrial systole. Systole means contraction in this case. So atrium contract. After atrium contracts, followed by the ventricular systole. So it means that ventricle, okay, is the one that contracts. Okay, ventricle is the one that contracts. So you follow atrial systole, ventricular systole, and then relaxation phase is termed as diastole. Are you clear? So you can see that systole contract. So atrial systole, and then followed by ventricular systole, and then followed by relaxations. Okay. So the cardiac cycle is a sequence of events which make up a one heartbeat. So consists of, okay, atrial systole, take about 0.1 second, and followed by ventricular systole, take about 0.3 seconds, and diastole 0.4 seconds. So if you divide, okay, the total process here roughly about 0.8 seconds. Can I see that? So if you divide 60 over 0.8, you get about 72 to 75 heartbeats per minute. Okay, 72 to 75 heartbeats per minute. Okay, so let us look at what are the events that actually take place now, okay, in this diagram. So as I say that, we start, because it's a cycle, we can start it with any part first, but I prefer to start it with the atrial systole. And we need to know that when atrial systole, when contraction of atrial take place, ventricle have to relax, correct or not? If no, if I want to contract the atrium, ventricle also contract. Where is the space for us to actually empty our blood, correct or not? So in the whole process, very important, first thing, you can see that atrium contract. So start with the atrial systole. So when the atrial systole characterized by what event? The contractions of the atrium. So when atrium contracts already, means that the blood is going to flow from the atrium to ventricle, correct or not? Atrium to ventricle. Why? Because when contractions of the atrium, increase the pressure. So the pressure inside the atrium is higher than the pressure inside the ventricle. Therefore, the blood actually move. Okay, the blood actually move, pass through what? Pass through this pass through this AV valve. Can you see that? Atrioventricular valve. So AV valve now open, allows, okay, open, that allows the blood to enter into the ventricle. Okay, now next, done the first event already. So followed by 0.3 seconds of the ventricular systole. So what's the ventricular systole? Ventricular systole, during the ventricular systole time, actually our atrium diastole. Atrium actually relax, okay? So if you look at this, atrium relax, ventricle have the high pressure, so means that the blood now, they do not know the direction. Always remember, bloods, they do not know the direction, depends on the contraction. So if you contract, means that ventricle contract, it will going to increase the pressure. When you increase the pressure, what will happen? Now look at this. When we increase the pressure, look at this, so pressure of the ventricle is higher than the atrium because atrium relax. Pressure of the blood inside the ventricle also higher than this artery, pulmonary artery or aorta. Correct or not? So means that the blood have two ways, either going back to the atrium or enter into the artery. But with the presence of the AV valve, so this pressure, we're going to push this AV valve, but the AV valve, the cups here will close. So the closure of the valve creates the first heart sound. So if you look at listen to the heart sound, you can see that it's a loop, do, loop, do, loop, do. So the first heart sound, loop, do, loop. So this loop actually because of what? This loop because of the AV valve close. So the closure of the valve actually is so strong, it creates or it produces the sound. So this sound can pick up if you use a stethoscope, or you just simply put your ear next to the heart. You can listen to this heart sound due to what? Due to the closure of the AV valve. And slowly, because of contraction, so in this case, the contractions take place, the contraction now strong enough to push the blood into the pulmonary artery in this diagram or aorta. Okay, can you see that's the one that I highlight here? So the contractions here, increase the pressure in the ventricle. So this pressure of ventricle is higher than the aorta or pulmonary artery. Therefore, the blood now can enter into the either pulmonary artery or aorta, open the semilunar valve. So if you talk about the pulmonary artery, then this is a pulmonary valve. If you talk about the aorta, then this is aortic valve. Both of them, they are semilunar valve. Okay, so now one more event that actually take place during the diastole, ventricular systole, because atrium already relaxed. So when the atrium relaxed, then the blood actually can enter into the atrium. Are you clear? So the blood enter from where? From the superior vena cava and also the inferior vena cava, or from the pulmonary vein. Okay, so the atrium now fill up with the blood. So after 0.3 seconds of these contractions of the ventricle, now you can see that we enter into the diastole. So both atrium and ventricle relax. But do bear in mind that, okay, when our atrium relax, our atrium relax actually during the ventricular systole time. Okay, but at this time, this 0.4 second, both of them relax. So because both of them relax, what will happen? Look at the ventricle. Ventricle, look at this, ventricle, when relaxed, pressure is lower, but the blood, we just pump it into the artery. So we just pump it artery means that this artery actually having the high pressure blood. So means that if I relax, means that blood can actually backflow. Can you see that? The blood can flow back to the ventricle, but this is prevented by what? By having the semilunar valve. So the closure of semilunar valve here created the second heart sound. Okay, second heart sound. So that's why loop, dup, loop, dup, looped because of the closure of the AV valve, dup because of the closure of the semi-lunar valve during the diastole. So, okay, can I see that? Why? Again, because the atrial, okay, sorry, atrial, the ventricular diastole. Ventricular diastole means that they relax. So when it relaxes, so the pressure inside actually decrease. But the bloods that we pump, we just pump it into this pulmonary arterial aorta. They are high pressure. They have pressure. They have the ability to go back, but this can be is prevented by having this semi-lunar valve. The closure of the semi-lunar valve now creates the second heart sound. Okay, and in this case, now because the atrial during this ventricular systole, atrial relax. When relaxed, blood enter. So with the accumulation of the blood is heavy, right? So actually at this moment, AV valve already start to open. So meaning that some of the blood actually drip into, some of the blood start to drip. Because why? The pressure, accumulations of the blood here increase the pressure. Here also, because of the relaxation, decrease in pressure. So the pressure in the atrium higher than the ventricle, actually it push opens the AV valve, allowing the blood now enter. But it's not all, it's drip down. Okay, until we finish the diastole contraction, we'll make sure that we pump all the blood enter into the ventricle. Okay, so complete one cycle now. So as a summary, Okay, as a summary. Okay, so we start with the first phase, which is atrial systole. Lasts about 0.1 second. So what is the main event here? So main event, so contraction of atrium or atrial. So it means that we increase the pressure. Okay, second. So when you increase the pressure, so the pressure in atrium is higher than the pressure in ventricle. Okay, so means that which direction the blood flow? The blood flow now from atrium to ventricle. Okay, so means that our AV valve open. But again, guys, be careful when I say this AV valve open, because when you say AV valve open now, it doesn't mean that it only open at this moment during atrial systole, because AV valve already opens during the diastole. Okay, so now this is atrial systole. Any questions regarding the first part? Okay, contraction of the atrium, so increase the pressure. So the pressure in the atrium higher than the pressure in the ventricle, therefore the blood now can flow from the atrium to ventricle, and AV valve actually opens. Okay, second. So when you finish with atrial systole, followed by the ventricular systole, which lasts about 0.3 seconds. More event actually take place. So first, we have the contractions of ventricles, both ventricles. So it means that increase the pressure. Okay, so now the pressure in ventricle higher than the pressure in atrium. Okay, in atrium. Okay, so pressure in ventricle is now higher than pressure in atrium. So it means that the blood can backflow, right? But backflow of blood from ventricle to atrium is blocked. How is blocked? Blocked by closure of AV valve, and this closure of AV valve actually give us the first heart sound. Okay, the lobe. Okay, now because of contraction slowly build up, so now the pressure, okay, in ventricle higher than the pressure in the blood vessel. So in either pulmonary artery, pulmonary artery, pulmonary artery, and also the aorta. So therefore, what is the blood flow now? Blood flow so from the ventricle into aorta or pulmonary artery. So in order for the blood to move from the ventricle into aorta, pulmonary artery, so therefore semilunar valve open. Okay. So this is ventricular systole, the event that takes place. Okay, but I haven't done yet. Some special things that we need to know during this period of time. Atrial, okay, atrial diastole take place. During this period of time, atrial diastole. Are you clear? Means that relaxation of atria. So what is the thing here happens here? If atrial diastole, so actually blood enter into atria. Clear? So this is the second part, lasts about 0.3 seconds when we have the ventricular systole. Okay. Now after this, what happened? So the third stage, when we have both of them, okay, diastole. So what are the events that take place here? So both atria and ventricle relax. Okay, so we look at the first one. When ventricle relax, so means decrease the pressure. Cannot. So means that the pressure of ventricle is lower than the pressure of the blood inside the aorta or pulmonary artery. So what will happen? Backflow cannot. So but backflow. Okay, backflow of the blood from aorta or pulmonary artery, okay, is blocked. It's prevented by closure of semilunar valve. And the closure of semilunar valve produces a second heart sound, which is the dub. Okay, so lub dub. Okay, in this case. Okay, so this ventricular relax. How about atrium? Atrium also relax at this moment, but and the pressure in atrium is higher than the pressure in ventricle. Are you clear? Because why? Due to accumulations of the blood. Okay, so therefore you can see that AV valve open. So AV valve actually opened during diastole, but it continued to open, allow the blood to continue to pump from the atrium to ventricle during the atrial, okay, systole. So AV valve opens, so therefore the blood flow from atrium to ventricle. Are you clear? Okay, so you can take a photo if needs. Okay, the summary. I think I need to make it step by step. Okay, so start with first this one. Wait, guys. Okay lah. No. Stop the recording. Okay, so we have done the entire cardiac cycle already. So let us look at the answer for these activities. So we need to complete the passage by using the given term here. Okay, so let us look at answer now. So when the heart is filled with blood and the muscle in the atrial wall contract, so this stage is known as atrial systole. So the pressure developed by this contraction is not very great, okay, not very high if compared to ventricle, because the muscular wall, okay, of the atrial are only thin, but it's enough to force the blood in the atrial down through the AV valve, okay, atrial ventricular valve. So it depends on which side you are explained. If the question gives you left side, then it will be the bicuspid. If a right side, then it's a tricuspid valve. But generally, we use the term AV valve, okay, into the ventricle. So the blood from the atrial does not go back into the pulmonary vein or the vena cava because they have the semilunar valve to prevent the backflow. Now, this part a little bit confusing because just now we say that, okay, the heart, between the heart and also the vena cava or pulmonary veins, they do not have a semilunar valve. But this semilunar valve that refer here is a semilunar valve along this vena cava or pulmonary veins. Okay, so let me show you guys this. It basically means that if let's say this is my, okay, if this one is my right atrium, so this is a vena cava. So we don't have any valve between the vena cava and right atrium, but vena cava itself do have the, along the vena cava, they do have this valve. So this valve actually prevents the backflow of the blood into vena cava. No, it started here, it stopped already. So then come out. Can you see that? Something like this. Okay, and then go to the right ventricle. So about 0.1 seconds after the contractions, then the ventricle contracts. So this process is termed as the ventricular systole. The thick muscular wall of the ventricle squeezes inwards onto the blood, increasing its pressure and push it out of the heart. So as soon as the pressure in the ventricle becomes greater than the pressure of the atriums now, so this pressure difference will push the AV valve, okay? So this AV valve will shut, right? Because we will want the backflow, okay? So preventing the blood from going back into the atrium. So the shutting of the AV valve produces the first heart sound called looped, okay? So the loop. So this is the looped sound, so loud that you can pick up if you use the stethoscope to hear it, okay? So the high pressure in the ventricle forces the blood to rush upwards into the either aorta or pulmonary artery, pushing open the semilunar valve in this vessel. So during ventricular systole, the muscle atrium actually relax. Always remember, relax here. So ventricular systole lasts about 0.3 seconds. The muscle then relax. As the muscle relax, the pressure in the ventricle now decrease, okay, or dropped. So the high pressure blood, okay, be careful, not high blood pressure. High blood pressure is a disease. Are you clear? In this case, it's not disease, it's just normal, but it's the blood with high pressure. So this high pressure blood, okay, which just been pushed into the artery, either the aorta or pulmonary artery, will flow back into the ventricle, but for the presence of semilunar valve, then this semilunar valve actually close. So the closure of the semilunar valve produces the second heart sound called dup. So loop, dup, okay, in this case. Okay, so during diastole means that both of them now, as the whole of the heart muscle relax now, so the blood from the vein flow into the two atrial. So this blood is at very low pressure, but the thin wall of the atrial are easily distended, providing very little resistance to the blood flow. So some of the blood trickle down, okay, into the ventricle through the AV valve. So AV valve now open, so the atrial muscle then contract to push the blood forcefully down the ventricle, and then you can see that the whole cycle now begins again. So in figure 6.27, you can see that do not need to worry about early or late. Okay, just follow the entire thing here we call as the ventricular systole. Okay, and this part actually is a diastole. Here, so look at this. Very, very important. Very, very important. Look at this. So during the atrial systole, definitely atrial contract, ventricle must be relaxed. Okay, they can relax together, but they cannot contract together. Okay, so during a ventricular systole, atrial relax, but ventricle now contract. Diastole, both of them relax. Okay, can you see that? Okay, now next, you can see that the AV valve. AV valve here, when atrial systole definitely open. Why? Because we need to allow. Okay, we need to allow the blood to move from the atrium into the ventricle, so open. Okay, then how about AV valve close? Because ventricular systole take place, so the blood pressure slowly increase. Okay, are you clear? Take a little bit of time, say the delay, but don't worry about the delay. This little bit of delay is negligible. So taking a little bit of delay here, when the ventricle start to systole already, it take a little bit of time to actually close the AV valve. Are you clear? So during diastole, you take a little bit of time here to open back because we need the times to gather sufficient blood. Okay, so how about semilunar valve? Semilunar valve initially closed. Okay, initially closed. Why? Because the blood pressure is higher, right? Okay, because at this moment, can you see that semilunar valve? At this moment, my ventricle relax, so the blood inside the aorta may move back. So we close it first, but after that we open. Okay, we need a little bit of time difference here. Why? Because we need to generate sufficient pressure to push open the semilunar valve. Okay, so after that, when the ventricle relax, we need to close it already. Okay, so you look at this diagram, so we can see that's what actually happened during the atrial contract and atrial relax. Okay, and atrial relax, relax. So means that when this is referred to atrial systole. How about ventricle? When atrial contract, ventricle relax. Can you see that? Okay, when atrial relax, ventricle contract, and then both relax. Okay, so don't worry about the early and the late. So for us, all we put it as together. So during the atrial systole, atrial contracts. So therefore, AV valve open, semilunar valve have to be closed. Okay, because why? Because our ventricle actually relax. When ventricle relax, the blood can move back. We don't want the blood to move back, so semilunar valve close. Okay, and then you can see that next. So during a ventricle contractions, the first thing, early phase, we need to close. Okay, this AV valve. Okay, we force it to close so that it won't backflow, and then semilunar valve opens because we want to pump the blood into the pulmonary artery or aorta. After that, both of them relax. So atrium and ventricle relax. AV valve and semilunar valve close at this moment. Okay, a short period of time only. Okay, then atrial actually passively filling with the blood, and then after that, contractions allows the blood to to move. Okay, this will be the atrial contractions here. So we can plot a graph. Okay, we can plot a graph to show. Okay, plot a graph to show the change in the pressure. The change in the pressure. This is something fun for us to actually look at it. So this one is the left side of the heart. So be careful when answer the question, because left side of the heart and right side of the heart, the valve involved is slightly different. Okay. Now, if you look at the left side of the heart first, our left atrium. So during this period of time, can you see that? So this period of time is atrial systole. When atrial systole, ventricle actually relax, diastole. So atrial systole, ventricle diastole. So therefore, you can see that there's increase in the blood pressure. So the blood pressure increase in the left atrium, cannot. Okay? Because of what? Contractions of the atrium. So next, what actually happened next here? Look at this. Focus at this region. Do you realize that now the red color refers to the ventricle? The pressure of the ventricle now suddenly shoot up. So suddenly shoot up, why? Because ventricular systole takes place. Can you see that? Suddenly shoot up. So the shooting up of this pressure, can you see that? If I shoot up like this, the pressure of the ventricle higher than the atrium. So the blood, the backflow of the blood can take place. So in order to prevent the backflow, so at the intersections here, can you see that when two graphs, okay, if I put it this way, this is for atrium, this is for ventricle. Kind of, okay? So at this region, can you see that immediately after this, the ventricle pressure is high, right? So immediately at the junction here of both, can you see that the intersections here, at the intersections here, what will happen? The AV valve have to close already because the blood pressure inside the ventricle is higher than the atrium. Correct? If you don't close it immediately, what will happen? Backflow take place. So this AV valve, or because it's the left side, you can call it as a bicuspid valve or mitral valve, actually close. Are you clear? Why close? Because the ventricle pressure is higher than the atrium. So immediately higher, we have to close already. If not, the bloods will enter back to the atrium. Are you clear? Okay, but my AV valve closed already. My semilunar valve, sorry, semilunar valve here. This is semilunar valve because it's the left side, so it's aortic valve. Okay, so it's a semilunar valve. So this semilunar valve open, but it's slight delay. Why? Because we need to build up the pressure. The contraction is not like straight away. It's slow. Even though I say slow, it's within millisecond. Okay, so the contraction take place, pressure build up. You realize that at these intersections here, the red line actually is higher. The red line, can you see that? Is higher than the black line. The black line is referred to aorta. So it means that the pressure of the blood inside the left ventricle is higher than the pressure inside the aorta. So therefore, you push open the semilunar valve or aortic valve, allowing the blood now enter into the, you see that? Enter into the aorta. Okay? Now, can you see the blood pressure decrease? Okay? So when the blood pressure inside this, okay, again, ventricle decrease because why? Diastole already. Diastole take place. Diastole basically means that relax of the ventricle. So relaxations of the ventricle, so ventricle pressure now decrease. So once the pressure of the ventricle lower than the pressure of the aorta, so immediately we don't want the backflow of the blood from the aorta back to the left ventricle. So therefore we need to close it. So again, semilunar valve here close. Are you clear? Why? Because the pressure of the ventricle now lower than the pressure of the aorta. Are you clear? Okay, so the pressure of the ventricle drop, can you see that? Drop below. When the pressure of the ventricle drop below the atrium, can you see it? Drop below the atrium. So it means that the pressure inside the atrium is higher than the pressure inside the ventricle. Therefore, AV valve now open. So when the AV valve opens, then the bloods can actually enter into the, from the atrium, enter into the ventricle. Okay, so always remember when you analyze this chart, very important, highlight those intersection line here. Okay, highlight intersection line. So you have the AV valve closed because of the pressure of the ventricle higher than the atrium. To prevent the backflow, therefore AV valve closed. At these junctions or the intersections here, why semilunar valve open? Semilunar valve open because the pressure inside the ventricle is higher than the aorta, so that we want the blood actually enter into aorta. Therefore, semilunar valve open. But at these regions, why semilunar valve closed? Semilunar valve closed because the pressure in the ventricle dropped below the pressure of the aorta. So in this case, we want to prevent the backflow of the blood from the aorta back into the ventricle. So therefore, semilunar valve closed. Okay. So when the blood pressures, okay, inside the, or the pressure inside the left ventricle lower than the pressure in the atrium. So atrium, the blood actually, with the higher pressure, definitely we're going to push open, okay, the AV valve, allowing the blood now enter into the ventricle. So the closure of the AV valve produce the first heart sound in the loop. and the closure of the semilunar valve produce a second heart sound called the dup. So look, dup, look, dup. This is how one cardiac cycle actually take place. So with this, I have done for the cardiac cycle. So the next lessons, we are going to look at how our heart actually can regulate this cardiac cycle by its own. Okay, so I off the recording now.